Given that David Snowden came up with this concept of a cynefin framework to deal with complex social change, and that it brings together systems thinking, complexity, big data and intelligence, but also the fact that narrative and storytelling is so crucial. And the framework has been used by a number of governments across the world, not least the Victorian Health Department, where they see it as a very practical way of taking the improvement in their health services forward. Now, systems thinking is popular, but essentially around cities. But I think that given that cynefin is a Welsh word, that the university here has a very long tradition of working with the communities in rural Wales, that a centre which uses systems thinking would be a partner to people working on systems in cities. So it's an opportunity to create a new way of looking at major change, which is essential because we have to transform the way in which health and healthcare is delivered in order to promote the well-being agenda. There's an opportunity for this university to build on where it is, the cynefin, and then to create an expertise for research, teaching, and also simply policy exchange and ideas, and then bringing connections from other parts of the world to help inform the debate needed to improve the health of the people that live in the Trinity St. David's cynefin.